Welcome to the Beyond Physio podcast, where we help you move, excel, and inspire others on your journey to your next level with knowledge and advice from experts and testimonials from our like-minded community. Julie, thank you so much for coming down to Cary from Durham. I'm really excited to share with our community your background in massage, in athletic training, and some of the cool things that you're going to be doing moving forward. And so let's dive in.
Sure. Perfect.
So, Julie, let's talk about being the owner of Dynamic Bodywork. It's been about 16 years.
Yes.
Tell us how it got started, what led you to that, all that jazz.
Long, winding journey. My background is in athletic training, so I've had the opportunity to work in college athletics. That's kind of what I first started into. I've migrated then into massage therapy and then also becoming a strength and conditioning specialist. So that's kind of been my journey. I've worked as a personal trainer. I've worked as a PRN in a physical therapy clinic.
Yeah.
And then I thought it was just time to branch out, and massage kind of is, I call it body work because it's the whole body. And that's kind of where I focus my attention.
Love that.
Mm-hmm.
I had, before I became a physical therapist, yesteryear, we'll say, I was also into bodywork myself. So I studied shiatsu in California.
Mm-hmm.
California's my first love. Everyone knows that. And I had some really great exposure to a lot of awesome providers there. And I learned a lot about not only the body before going to PT school, but also how to lay hands on people in such a way and really become intelligent as far as where to place hand pressure and how much pressure to put on.
Mm-hmm.
So I thought that was a very awesome experience for myself. Can you tell us about your transition from going from ATC over to massage, as far as how that transition happened and kind of what your experience was like there?
Sure. Yeah. When I graduated grad school and I had a degree in athletic training, sports medicine, I became a head women's athletic trainer at a Division III school.
Nice.
So that's kind of when you realize what you know and what you do not know. In addition, I was teaching different classes, and then you're assigned athletic training students. So you have to really know the material, and it highlights what you don't know as well. And working with athletes, they're young, they should bounce back quicker, they're lifting, they're doing everything that they should be doing. And what I found is I did everything that I was taught: heat, ice, stim, ultrasound, and they would plateau in their care. And I couldn't figure out what I was missing. I'm doing all the things I was taught. So what are the gaps? And I was introduced a little bit with some massage therapy. I started to implement it, but I knew I didn't know certain things. And I then left that college, transitioned, and had the opportunity to go to massage school. So I entered massage school, and that started to, like you had mentioned, I got better with my hand skills technique. I started to see connections that I didn't see before. As an athletic trainer, you're looking at joint, you're looking at injury prevention, but you don't look at the body as a whole. You look at it as the knee, meniscus, ACLs, but you're not looking at fascia, nerve, visceral components, and how that all ties together, right? Because we do have to get through school, or you would spend 20 years trying to learn
For sure.
everything. And then from there, I actually went back into college athletics. I worked at Furman University and had a unique position in that I was responsible for some of the athletic teams, but I also got to see some of the community in terms of orthopedics. So we had a PT working at Furman. They would come in, they would do the initial evals, and then they would hand that off to myself, and I would be rehabbing, a 50-year-old, a 60-year-old, which, again, I then came from an athletic standpoint. So this was a different demographic.
For sure.
You can't push as much, and they may have some underlying conditions that an athlete would not have at that time. But that, again, allowed me to put everything that I learned from a massage manual bodywork standpoint to test. And I was blown away by the progress and just the outcomes.
Yeah.
And you could even see it when I worked on athletes. They're like, we want some of that. Or the head athletic trainer was like, your athletes don't come in here as much. And I'm like, well, yeah, I'm taking the time to address the issue with hands-on instead of just putting stim on or doing some ultrasound and just leaving them there.
Right.
So, yes, it took longer, but the benefit was obvious for me.
You touched on something that I wanted to bring up, and that was I also felt that coming from that first body work and shiatsu and pressure, and taking that and going into my physical therapy education definitely helped me see things. And I hate to say holistic because I know that might be connotation, but really whole person.
Yes.
And so everything from the conversation starting off, it's not just about, oh, my elbow, my shoulder. What is it what is leading us to this point, having all the stress, that we're holding all the stress in our body? And for me, it was a very eye-opening experience, combining sort of that Eastern side of body work and combining with the Western side. I learned at Columbia for my master's. And it was a great fusion of seeing how we combine the two effectively and also provide the best outcome. Well, I felt the same way, where coming in with hands-on knowledge helped me become a physical therapist for sure.
Yes, I would totally agree with that. And I think that's something that maybe should be starting to become implemented in some of the other allied healthcare professions.
For sure, yeah. So it sounds like we had a couple of key milestones in that 23 journey that you had, 23-year journey. And tell us about some other things that might have happened along the way that helped to give you that integrated approach to rehabilitation and performance.
I think, too, it's just sometimes the people that you meet along the journey. I had my professor in massage school. He was actually going to acupuncture school.
No way.
Yes. So it was really interesting, the little things he would teach us. And then I think he might have been my first, like I said, can I get a massage from you? And that was like, oh, I can now experience what it feels like. And he did some other holistic things such as Reiki, which is an energy work. Again, I try to keep one foot in Western medicine and one foot in that holistic Eastern medicine, because it has been around forever. And it's very interesting that if you do, as a sidebar, look at, like I mentioned, he was going through acupuncture. If you look at the acupuncture meridians and then you overlap those with the myofascial lines, they line up. And so there's something to that. And there are reasons why that has occurred. But yes, it is fascinating. So I try to keep one foot in one Western and one foot in the Eastern, because there is some validity to that. So getting different types of treatment. And obviously, I think we all get into something because we've gotten injured at one point in time. And then we have to try to figure it out ourselves, different techniques. And sometimes you just have to do the research. You have to be intrinsically motivated to find solutions. And that's kind of how I approach different things. It's like, I don't have the math side to be an engineer, but I can reverse engineer things really well, and I can pull the lens out and look at things from what I always say, is it local or is it global? Is it coming from upstream? Is it coming from downstream? And then you have to figure out within those parameters, dig a little bit deeper, what body structures are being affected.
I like that, Julie, because I did earlier, but talking about how if you want to be successful as a physical therapist clinically, one of the things that has carried over with me for the past 23 years now has been the curiosity. And I think if you remain curious in your field, number one, prevents burnout, because you won't get bored.
Sure.
Because no two diagnoses coming in, if they have the same exact diagnosis, they're never going to present the same.
Correct.
And you take an age, you take an activity, and it very much differs that person from the next. And what I love about you calling yourself a thinking body detective, I want you to dive into that, because I feel like that's what we do. We are really trying to investigate what other underlying issues might be there, like you said, whether it's local or global, but also making sure that we find the right root cause as to why this person is having this issue in the first place.
Yeah. So I think as a body worker, I have a little bit of an advantage just given my background with the athletic training and having gone through like orthopedic tests and understanding the whole kind of complex rehabilitation protocol. But at the same time, I think of myself as a body detective. So even I've had clients for 20 years, but every time I see them, that's a new person because they've left, they've had stress, they've sat at a computer, or maybe they've tried a new activity.
They got older.
Yes. And that's the thing. So even if I've had somebody for 20 years, each time I see them, they've had different things going on in their lives. So I have to reassess each time. I love what I do. I love getting up in the morning and going to work. Not many people can say that. And that's why, because that person coming in, something new is going to happen. So I can't predict what each day. And so, yeah, that body detective. So when somebody comes in, I guess one way I do structure a session, and this may make it a way to understand what I do and what I mean by that, is if you come in and you say, oh, I've got pain here. Okay, that's fine. And I always use analogies in my practice, like X only marks the spot on a treasure map, right? And pain is usually not where the problem is. It's the end result of dysfunction, compensation patterns. So when people come in, I have them come in and have them bring a pair of shorts. And for the ladies, I have a sports bra that I can access the back, or just a regular bra that's fully covered. And I just look at them and look at their body posturing and how they hold themselves. Look at them from the front, from the side, and from the back. And then I'll have them do kind of like a functional movement screening. Raise your arms up. Can you do a squat? Can you do a lunge? And then what activities are causing this increased discomfort, and see what they can do. And then based on that, I'll have them get on the table. I might do some functional orthopedic assessments, look at their leg length, because things change from a standing to a supine lying down position. And then we'll get to work. And I like to explain things to clients so they feel responsible and accountable for what we're doing. I'm just a facilitator. Their body's very smart. Their body knows how to fix itself. I hold space and I help the body navigate the healing process that it might have forgotten how to recover and do. And then I explain things that clients go, oh, if I do that, this happens. So how do I modify that throughout the course of my day? And then that way, I could see someone every single day for an hour. But if they go back and for 8 hours do the exact same thing, 8-1, I'm losing every time.
Same with us. I think it's a losing battle for sure.
Yes. But if I can teach them that, they always come in and go, I know, I'm wearing my shoulders as earrings. But now they know that this is not a good place to be posturally.
Yeah.
And then they can just kind of get that scapular retraction, and then they go, oh, okay. And so I give them little tidbits to do so that they then can modify the pain and be accountable for the healing process as well.
How much of your clientele, you would say, Julie, come with a lot of stress, and as a result have changes in the way that their body maybe moves or the way it responds to?
All of them. All of them. Whether they realize it or not. Yeah. And a lot of times when people come in, they're in pain or a lot of pain. And so there's that disconnect, right? If there's an irritating noise, you kind of shy away from it and you distance yourself. And I think we do that with the body. If your knee hurts, you try to just ignore it. And then you compensate, and you don't pay attention to the compensations because it hurts. And so there's this disconnect. So reconnecting once we try to get them out of the discomfort, it's key. But yeah, I had one lady one time come in on the table, and I said, oh, yeah, you're type A. And she goes, I'm type A? And I'm like, you don't know that you're type A? She goes, how do you know? I said, because I'm type A. And so I understand the stress and I understand the compensations, but yes, because we're just inundated with so much information, and it's just the repetitiveness.
Definitely. You know, it's funny because one of the questions that we ask our clients when they come in is, and we take them to a whiteboard session. Mm-hmm. And so one of the questions is, tell us about your stress level, because I can use all the fancy gadgets I have. I can go through these different protocols and whatnot, but if I can't help you manage your, and it may not be my place to do that, but if you can't manage your stress, mm-hmm. I can tell you that no matter what I do, you're probably not going to get the best outcome from what I do. So we have to figure out ways to modify that.
Mm-hmm.
And sometimes people need other outside counseling, which is not uncommon. And especially with, I would say, upper quarter issues for sure, and low back pain for another. But on top of that, making sure that they understand that they're aware that they have to make lifestyle changes in order for them to get the best outcome from physical therapy. I would imagine from massage therapy as well.
It is. And sometimes those are hard conversations to have. And I have had those conversations where a client would come in and I said, oh, did you make any modifications? And they're like, no, I don't want to. I said, okay. So as long as we have an understanding that if you don't make changes, we're going to plateau, and I'm doing everything that I can. So as long as we have this understanding, we're good, right? And that's fine. And they were. But yes, and that's a huge thing. And even just teaching someone how to breathe correctly.
Yes, I was going to ask you about breathing.
Yeah, breathing's a huge thing in the practice. And I try to explain why. But yes, everyone's a top shelf breather. And they don't realize, or yes, a neck breather, or they Buddha belly breathe, and they're like, oh, well, we do this in yoga. I'm like, but we're not in yoga. Yeah. So we need to teach you how to breathe correctly. And again, I use analogies. I use the rib cage as a bird cage because it's 360. Everyone knows what an old school bird cage, Sylvester. And then you have the balloons, right? And the balloons are 360. You got to fill up your rib cage, front, side, and back. And that was hard for me. One of my mentors was a Rolfer, and he's like, breathe into your back. And I'm like, what? That's a thing? Like, how do you do that? And you can, but it does take practice. And once you start doing that, everything starts then to move and groove nicely.
You know, I love that you said, and actually, Julie, what's awesome is that you're probably the first provider I've met who's talked about breathing three-dimensionally, because I think everyone sort of out in the world understands, oh, we got to breathe through diaphragm for whatever it is. But the 3D canister, that 3D approach is not a very common explanation, which I'm glad you're doing. And we also tell our clients that we have to align that rib cage diaphragm with the pelvic diaphragm so that you can get maximum out of that system. Otherwise, you're really only getting part of the system to function the way it should be, especially when you're talking about athletes and active people. If we can't get that alignment there, then we're not going to be able to get the most out of our mobility in our upper or lower extremities.
Yes. Yeah. There's a huge, it's like an accordion, especially with the pelvic floor. And that's a whole nother subset. And I have to ask my PT friends that have a specialty in that, because again, that's just, there's such a connection. And then you have your thoracic inlet, and that's another diaphragm too. And I think people don't realize that your lungs come so high up, and they're like, your lungs are that high? I'm like, yeah, they are. Right. But yeah, and that's, again, why I love this work, is because it's body awareness that I can start to weave into sessions, and clients start to then understand their body and how it works. And clients all the time, whether they want to know this information or not, I give it to them during a session, and they're like, oh my gosh, every time I leave here, I learned something new about my body. And I'm like, good. You've got to be your own advocate for your own body. For sure. And I love helping them on that journey.
Yeah. You know, one of the things that you do, which I used to do a lot of when I was doing massage therapy, was seeing that we can get more out of what we do on the table when we combine it with movement. Can you dive into your approach on that?
Yes. So what I was talking about before with how I structure a session, I'll work on somebody and move them. So if it's a shoulder, I'm going to move their arm, whether it's I'm coming through the pec and having them do some abduction, or if I'm doing internal, external rotation through the deltoid, because that kind of twists and wind. But they usually start to see, if you do this long enough, that there's correlations. 9 times out of 10, if someone delts are tight, their upper traps are going to be tight. And so you start to see this stuff time and time again. But yes, you have to do movement, because we're moving individuals. I always say motion is lotion. So you have to move. It's just like a can of DW-40 and a door with a hinge. I can squirt it on the hinge, but I have to move the door to get through the nooks and crannies. And the tissue is no different, and the body's no different than that. You have hyaluronic acid and just again, the blood flow and the lymph, and that has to be pushed through the body as well. So when I work on somebody's shoulder and I say, okay, let's get up off the shoulder or get off the table and let's repeat that range that you did when you're standing. Better, worse, or the same. And then I start to see if they've compensated somewhere else that I fixed it. But then I have a mirror that they can look. So now they're getting biofeedback, and that is huge because I want them to see that immediate change, not only visually, but neurologically as well. And so that's a big game changer. And then we'll get back on the table and then they're like, oh, well, now I feel it here. Okay, let me work over here. And sometimes they'll say, I have the pain here. And I go to the other side. They go, no, I said the pain was over here. And I said, okay, here's why I'm doing this. And especially in the hips. Yeah. So they'll get pain on the one side and that's actually more mobile and they're actually stuck on the other side. Yeah. And so the other guy is throwing a fit because he's pulling all the weight and we have to unstick the non-functioning one, but that's not the painful side. So you start to see correlations. And then once you can explain it, they're like, oh yeah, that makes sense.
I love that test retest because I don't think enough in my field, I don't think enough PTs do that. And a lot of them are on time constraints, of course, as you know. So that's why they go to people like us where we can actually spend time with them and go over things in more depth and scale. I also find that when you do educate your clients, and some of you do as well, on the benefits of and the reasons why we're incorporating movement, it really does reinforce in their minds, I actually have to move to make sure that I'm getting the most out of each session as well.
Yes. Yeah, I think that's huge. And if you give them some accountability and that they can control it, not that like, oh, I have to go see this person or it won't get fixed. No, you can fix it. I'll teach you how. Because I can't be on the road with you when you go do an ultra marathon, So, yeah, if I can give them the tools, that's fantastic.
Awesome. So let's dive into that neurovisceral connection. And let's go into that because I think that this definitely separates, among other things you've already talked about, by the way. This also, I think, separates you from other providers out there.
Right. And this is a little bit more recent coursework that I've actually taken when someone's like visceral. And for the audience, visceral is just your organs, right? And people are like, how are you going to massage my organs? But we're all connected, right? And we're just not connected on the outside, but we're fascially and we're connected on the inside. And so how I explain it to people a lot of times is if someone goes, oh, I'm having a heart attack, you're like, how do you know? Oh, I get left jaw pain. It's going down my left arm. Oh, I have gallbladder issues. How do you know? I have right shoulder blade pain. So there are some indications when the organs are not working optimally that they show signs somewhere else. So I was introduced to some of the visceral work. And again, it was that mind blown. And I'm like, this is a thing? Like, I'm not sure how, but I don't know sure how radio waves work, but I know if I turn the dial, I can dial in on something. So that's always a good way I try to explain it. So to answer your question with the visceral, and I'll give you a client example. I had a young lady who's super stressful. It was during COVID, and she was traveling back and forth to Illinois, and her mom was very ill. Her mom had passed, and now she was trying to caretake and juggle a lot of things. She came to see me afterwards, and her right shoulder was a rock. I tried absolutely every tool, everything that I have learned over the years, could not figure out why this would not release. I would touch it, it would literally come up and drop down. It would come up and drop down. So I had gone to this visceral class, and I said, can I try a liver release? And she's like, at this point, I don't care. Yes, you got a voodoo doll, whatever you have. Fine. And I said, okay, let's try a liver release. We did it, and she did not get the spasms. And when she left, things had calmed down. So I saw her probably a couple weeks after, and she goes, I don't know what you did, but I could tell a huge difference. I need you to do that liver release again. So when you're talking with viscera, you're like, well, how is that connected? You know, the hip bone's connected to the liver. Actually, the coronary ligament that comes off of the liver is attached to the diaphragm. And that diaphragm, as we just discussed, and with the lungs, comes so high up. And sometimes you can get a referral pattern from the diaphragm into your right shoulder, and it can irritate the phrenic nerve. There's the connection. But I never in a million years before taking a class thought my liver was connected to my shoulder. So there's these amazing connections where clients come in on the table and I'm feeling tightness. I said, do you get reflux? And they're like, how do you know? And I'm like, oh, I can feel the tightness and the restriction. And I actually had a lady this week and I worked on her and she goes, oh yeah, I'm not feeling that with me lying flat on the table. I don't feel like I need to be propped up. And it's an immediate. So you get that really nice feedback, and then I can teach them how to do the technique if something flares up. Obviously, it's easier if I can do it, but yeah. And so I was blown away by that. I'm like, oh my gosh, it works. And it worked again. Yeah. I'll keep doing it.
I think it's, and I'm so glad you brought that up because I remember having some experiences before, actually from a rolfer back in the day, and I wanted to talk about fascia because I think that in the audience, if you're listening in, fascia is everywhere in our system. So as Julia said, yes, organs and yes, everything else, but the way that it pervades every single part of our bodies is extraordinary. So if you do hold tension in one area, it will start pulling towards that area.
Correct.
If you think about taking I would say, if you have the saran wrap, if you were to pull that, everything's going to go towards that pole, and that's what happens with fascia as well. Can we dive into how you address the fascia, Julie?
Yeah, so then we're getting into some of the anatomy trains and some of the fascial lines. Yes. The really good analogy I like to use with some of the fascia in kind of your saran wrap analogy is it can get tricky because you have arm fascial lines, you have deep fascial lines, you have posterior fascial lines, you have lateral, and then you have a spiral line. Yes. So, for example, with the spiral line, if I take my T-shirt and I pull it down to my left hip, the restriction is in my left hip. But if you look at my shirt, all the lines are pointing to my right shoulder. So I may be getting right shoulder pain. However, the dysfunction is into my left hip. And we use a word in body working called tensegrity. And that's tension and integrity. And yes, fascia is unique because you have superficial fascia, which is under the skin. Then you have kind of the deep fascia, and that helps go around the muscles, kind of like in the lower leg. You have different compartments. So I love analogies. It's like if you have 4 different egg rolls and you put fascia or you put saran wrap around each egg roll. So that's your deep. And then you're like, well, I've got 4 egg rolls. I can't hold all 4. Then you put fascia around each of those to keep them in a container. But the inner fascia has to slide and glide, and then the big ones have to slide and glide as well. So that's where the deeper ones have the hyaluronic acid, and that's where the motion and lotion comes in. And it's everywhere. It's like basically your wetsuit. It's your skin suit, and it weaves in and out, and that's why it affects the fascia as well. And some people go, well, have I ever seen fascia before? So when I worked at a PT clinic, I would typically say, come here, one of the PT students that was doing an internship. And so I would expose them to some of the body work. And I'd always do the chicken analogy. So here's your chicken analogy. Everyone has seen chicken breast. They might become a vegan after this. Not sure. But we've all seen chicken breast. Yeah. And there's that real thin, clear kind of film. Almost, it's slippery, almost kind of snotty. And the analogy is and that's fascia. That's that deep fascia that goes around the muscles, right. Whatever muscle it is. Could be a quad muscle. Well, I have 2 pieces of fascia touching, or 2 chicken breasts touching. And then if I take some penne pasta and put it through, so those are the nerves, that could be the lymph. And if I shake that plate, if that's healthy fascia and healthy muscle, it should slide and glide and almost like fall off. If I were to leave that in a static position, whether that's you're immobile because you're in a cast, you have an injury, or just hurts or you're stuck in a chair for 8 hours and you haven't got up, that fascia, if you leave chicken breast overnight, it starts to shrink. And then when you pull it apart, you get these like long, like snot kind of sticky, matted. And sometimes in body work, we call that the fuzz. It almost looks like a cotton candy, but it's really hard. So that's what we're trying to break up so that things will slide and glide. And if those chicken breasts have started to dehydrate, then they're putting pressure on that pentapasta and it's squishing down. Now you have less lymph. You're compressing nerve. You're compressing circulation. So that's a huge component. And I think that just kind of goes, oh, okay, now I understand what fascia is, why it's important to keep it hydrated, and how then it affects some of the other structures that are caught between the muscles. Because as you know, the nerves, the arteries, the veins, they all dip and dive and weave in and out, especially the piriformis. That can get caught in a certain population. It bifurcates. And then you get the sciatic nerve bifurcating the piriformis, and then now you have some issues. But we sit, and then that leads down another rabbit hole of how do you fix it?
Sure. I think that much more making sure that we always talk about movement. And I think maybe the clients you have and the clients we definitely have, I think that they actually sometimes move too much. Mm-hmm. And so we have a lot of people who overdo things. I am probably one of them myself, to be quite honest.
Sure.
And so as a result, there's a flip side where you have people who don't move a lot and have that stress that can be placed in their tissue from not moving. Mm-hmm. And then you have the people who overdo it, like myself,
sure,
and have the other extreme. Do you address that differently?
Those people, that's where rest and recovery, I think, really comes in, because the way you build muscle is to tear muscle. And so you get these micro tears and the body goes, oh, I'm just going to knit it back together and make it bigger, better, stronger. The problem is if you keep doing that and you don't give it a chance to knit together, then you're setting yourself up for injury. You're setting yourself up for scar tissue. When you rest and sleep, that's when your body then can knit itself back together. It can put its reserves back in. It can fill up that tank while you're sleeping. You didn't do anything. You just slept. So that's brilliant. And then you're also then getting all the toxins and all the byproducts out of your system. I mean, they say the brain shrinks at night so it can cross the blood-brain barrier, and then you basically, your garbage cans are taken out in the morning. You're like, I feel better. All I did was take a nap. So yeah, that's the brilliance of that. The other thing, I think, to your point, is when you say they move too much, what I see a lot is stretching. And at least my clientele is like, oh, but I'm stretching and I'm stretching. And I don't understand why I'm not getting any better. Or I stretch before I do this activity. And research has shown that if you stretch before you do activity, your force output is diminished.
I'm so glad you said that, because one of the groups we work with at Fleet Feet, and we do a lot of the warm-ups and stuff like that. And what we try to preach when we educate our runners is that, yes, mobility work, yes, dynamic warm-ups are really key, but the stretching and stuff like that, save that for after, if you're going to do it at all, and making sure that you are, if anything, more prepped beforehand with kinds of right level of activity to get you to the activity you want to do. So in this case, doing dynamic warm-ups so that you can start running, for example, would be really key versus let me stretch out for half an hour before I go run, and I don't know why I'm not so fast anymore. Something happens like that.
Yes, yeah, and I think that it took me a while. I'm like, oh, well, I've always been taught that you're supposed to stretch beforehand. And then I think people still have that mindset, and it's very hard to break. And I think unless you show them with like a force output or a hand dynamometer or something, that they can actually see the data. But yeah, and so I said, well, why don't we strengthen? And what I try to explain is if something feels tight, is it tight because it's spasming because it's weak, or is it tight because maybe you just did too much? And that's a hard call. If that's sometimes where you need to defer to somebody else, because it's hard to figure that out. But yeah, I see people really overstretching, and then they wonder why they're having an issue when they should be actually strengthening to create functional tone, not dysfunctional tone. And that's something I really try to drive home to my clients.
I love that you said that, Julie, because I think that we have a lot of weak people who do pride themselves in how flexible they are. But when you ask them to do things on a day-to-day basis, whether it's squatting or whether it's hinging, something that's very basic human movement, and they can't do this that well because they've been so loosey-goosey from different things. I'm not blaming yoga, but I know a lot of yogis who don't have great strength as far as that goes, and that I think can be a setback for many of them in the future.
Yes, and I think you said a key thing is flexibility, and I try not to use flexibility. I want them to get mobility, because mobility is the full range under control. And what I find, and I get this question all the time, and you might as well, where they're like, do you think I should do yoga or should I do Pilates? Now, the very flexible person.
Yesterday, by the way.
Yes. So the very flexible person, not me, would be, I'm going to do yoga because they're fantastic at it. But here's my caveat. Someone that like a gymnast or that's very hypermobile, maybe they have Ehlers-Danlos, maybe they have something else. The muscles don't stop the motion. It's the joints and the ligaments. And then they're the last stabilizers. They're not. You don't want to use those. You want to use your muscles to slow that motion down. And so while that is a great, yoga is fantastic, and I like to do pigeon pose and some other things, it always is probably not the best for a certain population, where I then might transition more to the Pilates, because again, it's a controlled motion through your end ranges. And a lot of times we struggle at our end ranges of motion.
Definitely.
Right? But yeah, so I totally agree with that.
Yeah. My friend Laura Hyman, who has her company, she's actually a physical therapist by training, Lit Yoga, LYT. And we did an interview many years ago. And I think what was great about her coming into yoga, in the yoga space, was coming in with that expertise, knowing that we're not looking to make people necessarily flexible per se. We want to get more motion for sure, but mobility is a big emphasis on what she does with her yoga and the way that she certifies her instructors as well. So I love that you're talking about that as well from a mobility standpoint versus just flexibility. So let's talk about active people. Are there any pieces of advice, Julie, that you would give particularly to athletes or active people to better understand and care for their bodies given their activity levels?
That's a really good question. That's a multifaceted question. And sometimes they have to seek out somebody to help them through that process. That can be challenging as well, because there's good and bad in every profession. And I would say, on a side note, if you're looking for somebody, make sure you ask them questions. Look at their bio. Look at how long they've been practicing. Look at the kind of continuing education that they have taken, and then say, how many clients do you work with this? Have you ever worked with a client with Ehlers-Danlos? Do you know that I have this other condition? And so you really have to be your own detective in trying to find those people, because I personally have looked at somebody's bio and go, oh, I think they would be a really good fit. And then I go in there and it's like they're a student just out of massage school. And I'm like, well, wait a minute, why are you not utilizing all of this stuff? And a lot of people can talk a good game. And I see that a lot. And so it's one of those things that sometimes you have to try people out. But if you find somebody good, they usually surround themselves with other people that are good, and they can help you get referrals. So if you have a very good PT, say, hey, do you know a massage therapist? Do you know a good yoga? So I have certain people that I will refer to because I trust them and their skill set not to harm my client. And I don't want to be, it's my client, because we kind of get into that toe stepping a little bit, or territorial region. But yeah, doing your own research, and then I don't know.
Yeah, I'd say just being actively involved in and being your own advocate in different areas for sure would be really helpful. I think because of whether it's time or because of convenience, I think people just make decisions. Oh, I just want to see them because they're down the street, but then they don't know it any better as a result.
Yeah, and I find that with people that I see for the first time, they're like, this is a little different than any massage that I've had before. And while going to a spa, lying on a table, getting a traditional massage, that is therapeutic. It's not how I like to practice. Again, it comes from my background and my skill set. And yeah, so it's always interesting when they come in, they're like, yeah, this is more like a physical therapy session. And I'm like, I'm not a PT, but we can help you with some things. And the nice thing as well is if I have a client and I would refer them to you, and we do share a mutual client, that I can text you and say, hey, this is what I'm finding. Let me know what you're finding and if I need to work on something in particular, because I don't care about egos. My goal is to get that particular client better and get them back to where they need to be. So some people can be territorial. They're like, what does this massage therapist know? She's a massage therapist. I'm this. I don't care.
Yeah, and I think that's why I like you actually, Julie, because I feel that we're on the same page about taking a team approach to helping our clients. And even if it's myself referring out to you because I know this person really benefit from massage, or to maybe sometimes a surgeon if they have to go that route, because sometimes it happens, unfortunately. But making sure that we are the right advocate for our clients too, but taking that patient-centered approach, I think really benefits that person. If we're looking to make impact, I know I can't do it by myself. I have to actually have other people around me to be able to help that person maximally from looking at their over medical and their stress levels and their nutrition and all that kind of stuff. It does take a team to help one person get to their next level, so to speak.
I would totally agree. And I've even referred my own clients to other massage therapists that I've used personally because I can't know everything. And some people just have a knack for a certain skill set. So I always tell my clients, we're not breaking up. You can see this other person and they can maybe get you past that plateau. And then if you want to come back or if you want to stick with that person, that's fine by me. You're always welcome back, but we have an open relationship. You can see other people, and that's fine because my goal is their healthcare.
That's awesome.
Yeah.
So Julie, I really enjoyed our conversation and learning more about your approach to how you approach body work, number one, and I love your patient-centered approach as well. What's the best way for people to find you if they want to work with you?
So here's the sticking point is my schedule is pretty packed at the moment. Yes. So if someone is having an issue and they want to reach out, I'm happy to do some consultation. If athletes want to get together and have me come out and teach them different modalities, cupping, how to use voodoo bands, things of that nature, I'm always happy. I'm a big advocate with education and teaching. And that's where I'm taking my next step. I'm working on a course curriculum to teach other massage therapists things that I've learned. So yes, and so I do have a website. It's dynamicbodywork-nc.com. That's my teaching site. So my information's on there. If anyone would like to reach out, that's fine. And I'll try my best to accommodate their request in a timely manner.
Awesome. I'll make sure we include that in the show notes.
I appreciate that.
Reach out to you. And I know that people will have a experience with you. Someone I would actually trust with you. So I'm glad we got.
Well, I appreciate it. Thank you again for inviting me on your podcast.
Awesome. Thanks for coming on.
Thank you.
Thanks so much for tuning into today's episode. It really does mean a lot to us. And don't forget to like, share, subscribe, or comment if you got at least one or two helpful insights or takeaways to help you get to your next level.